you get into activism? What's your backstory?
Story begins in Vancouver, where I was born and raised, and growing up in the late 60s and the 70s in Vancouver, being part of the university community, but joining the women's movement by the time I was 16. So it was very much part of my life, the fight for abortion rights, the fight for employment. So I really was grounded in the women's movement as a very young girl, growing up in a single father household with lots of challenges and experiences in a multicultural neighborhood in the heart of Vancouver. And I think that really sort of formed who I became in terms of activism, because I was deeply committed to human rights before I had the language of human rights. Deeply committed to everybody having a worthy life and being seen as equal and respected and having opportunity. I did do some work with kids with disabilities when I was during summer jobs, and worked with some kids with some pretty complex issues. And again, we had to set up a segregated summer camp for them so that they could have an accessible place, physically accessible, to participate in summer events. And it was a fun time. We really did give them a good opportunity, but they couldn't go off to the regular summer camps, because until we had groups, organizations in the 70s across the country forming to push for the rights of people with disabilities, really, people with disabilities were left out of mainstream community. So as you and I talked earlier, they weren't in the churches, they were in segregated classrooms in schools, if they were at school at all. They weren't visible in employment, or even just wandering the streets of the city shopping. We didn't see people. They were often in institutions, back bedrooms, at home. And as you experienced with Patty, trying to come out of the house to do anything was an enormous challenge for anybody who needed mobility aids, but also for people with intellectual disabilities, cognitive disabilities, mental illness. We did not have a welcoming country across the board to people with disabilities. So we had a history of segregation that was not termed that. It was by default, because we didn't have an inclusive society. We segregated people by default. So I was pretty much an activist in my mind and my heart before I ever started doing the actual work. So I moved to Newfoundland in 1982. And prior to moving here, I was diagnosed with a genetic hearing disorder called otosclerosis, which is progressive. So getting the diagnosis when I was about 26 was excellent, because I was trying to figure out why I was making everybody repeat themselves. So I was quite delighted to know what was going on. Very happy that I would be getting a hearing aid at some point. But the specialist who treated me also wanted to send me to a gynecologist. On my second visit to him, after we had determined that we might try surgery for it, which didn't work, he said, "Now I'm going to give you a referral to a gynecologist." And I stopped and said, "Whatever for?" And he said, "Well, your hearing aid your hearing issue is progressive. If you get pregnant, you might be deaf by the time you give birth. You certainly don't want that. And you don't want to give birth to a child that has the same thing you have. So far better for you to be sterilized at this point." I was 26. So that wasn't done. I refused to discuss that any further with him, and was really quite shocked and horrified, thinking about people I already knew who had a variety of disabilities that just wasn't on. Anyway, I left that behind and moved here, and went to work with an amazing organization called Civic Number 4 Espasoni Place, which was a transitional residential program for people with physical disabilities, adults who were coming out of institutions, out of rehab centers, out of homes, who had been some recently injured, some lifelong disabilities, seeking to set up independent lives in the community. Shortly after I came, I went to see a hearing specialist here. Same thing, I wanted follow-up. I wanted to know exactly when I could get a hearing aid that would be helpful. And didn't he, this other specialist on the very first visit, confirm the diagnosis and inform me that he was giving me a referral to a gynecologist because I needed to be sterilized. And so that was rather shocking in 1982 to be told the same thing again, that, that I should not get pregnant because I might be deaf by the time the baby was born, and that I didn't have any right to pass this on. And that was basically how it was presented. So I fired him at that point. I was now 28, and nobody was talking to me like that. And I thought to myself for so long afterwards, how dare the medical system from coast to coast, these old men, sit there and look at me and tell me what I had a right to do. So there I was, immersed in the pro-choice movement of being able to have an abortion should I deem it necessary. But I also had the right to have a baby if I deemed it something I wanted to do. And these fellows were quite prepared to take away both choices, I'm sure. So I didn't do that. But it really fueled that piece of personal anger at how systems treat people, because it just wasn't on. And I never did see him again. And I went for years working with hearing specialists and not seeing, or hearing aid specialists and not seeing any of the old men that were the hearing specialists at the time.
And that was the early 80s.
That was 82.
I mean, it sounds like something from 1882 rather than 1982.
I know. So that was shocking and made me very angry. And at the same time, I'm working with these amazing people who are battling the odds to get into the community and to live the lives they are choosing. So where are they going to live? How are they going to live? What work? What education? Just all of those things. And helping them on an individual basis navigate the barriers that are in the way. And as you knew from your experience with Patty, they were endless. And regardless of the type of disability that people had, they were tripping over things all the time. It was so clear that our society was built to exclude people.
So you were not then just looking at and fighting in terms of physical barriers or economic barriers, but it was a whole cultural shift that had to happen, a whole
attitudes,
philosophical, existential shift. Yeah,
exactly. And so the organizations that had been developing in the 70s by people with disabilities and some professionals driving some of the organizations really were developing philosophies that would change culture. So the independent living philosophy was about folks with any kind of disability having control over their lives, being able to grow up and make decisions, or being able to come out of a time where they'd been newly injured or developed a disease that was causing problems for them, that they would be able to have the locus of control in their very own hands at all times. So independent living was a strong philosophy to counter the medicalization of disability, which was that the doctors are going to tell you how to live, and you're going to go to an institution, or you're not going to have a child, or whatever they were going to tell us at the time. And there was a parallel movement going on because people with cognitive disabilities, many of them in our province were in Children's Home, Exxon House, the Waterford, back bedrooms. They were significantly isolated and locked up. So the deinstitutionalization movement that really moved right across the country was very strong in this province, and we had some excellent leadership to develop ways to using, again, a community living model and philosophy to argue with the decision makers and the funders to close down those institutions and get people into community. So group homes were devised, and alternate living arrangements were set up to, and I'll simplify all of the work that went on, but it was an immense culture shift for the funders, for politicians, and it was a hard-fought victory to get people out and close those places, and many, many years of work. So those two movements were very, very keen. And as time went on, we talked a lot about the consumer movement, the person with the disability being the consumer of services and being the person in control. And our work was really predicated on making sure that we kicked at the doors of decision makers and strengthened the voices of individuals so that they could do just that. And at the same time that there was the work around individual rights, there was also a great deal of effort put into ending systemic discrimination. So Coalition for Persons with Disabilities, in its origin coming together as a cross-disability provincial organization to tackle the big issues, the issues that were being faced by so many people. The Independent Living Resource Center or Civic Number 4, working with individuals to get their lives going in the direction they choose. Community living, getting people into community, and the big systemic advocacy through COD. So after a couple of years of working here, I moved to Stephenville and took a great job at the Bay St. George Community College, which was a leading community development college at the time. It was an independent institution run brilliantly. And the position I got was in response to the deinstitutionalization movement. So I was hired to help create and teach a 2-year program that would teach people to work with individuals in communities. So that people coming out of the Waterford, the Exxon House, Children's Home, would have group environments in many cases, but with really knowledgeable people supporting them to again have the independence in their life with the supports that they needed. And it was a great time to be out in Stephenville. When I moved, the Charter of Rights had come in 1982, but Section 15, which was going to protect the rights of disadvantaged groups in Canada, was coming in 1985. So I was in Stephenville from 84 till 90, and it was a hot time for human rights across the country, for the implementation of the Charter, and tons of systemic advocacy going on through COD, and I was the West Coast representative for that organization for much of the time while I was out there. It was also a time where there was federal funding for work, for actual advocacies, and there were...
And that came through Secretary of State.
Secretary of State, yeah, and I don't recall exactly when that was set up, but the women's program and the disabled persons program and seniors and youth, different arms of that office.
And we were able to access federal funding
for advocacy, which was brilliant.
Yeah.
Right? And to advocate against federal departments. Yeah. So there was money available to come together to further identify issues, although the issues had been developed quite nicely in the late 70s and the very early 80s. But to come together for solutions, for sharing. So it was a real time of leadership development for individuals in their own lives and for those of us working in organizations and volunteering in organizations. We really worked very hard to push that advocacy wheel, both federally and provincially and within local communities. And there was immense frustration while we were doing the work because to us the issues were clear, the answers were straightforward, the problem was attitudes. So if we think back about the work, we were constantly trying to reframe people's perceptions. And what we were fighting against was a huge culture of misogyny and ableism. And for women with disabilities in the middle of that, they were absolutely caught within both. And had a hard time with both the women's movement and sometimes the disability movement, because some of the organizations were very much male-dominated. So the women's issues, women who wanted to be mothers, women who needed support for parenting, just to be heard around issues of being women, was often lost to the conversation of pushing disability rights. And the mainstream women's movement was tackling large issues, but not in a nuanced, intersectional way. So we didn't have the intersectional groups. But that evolved through the 90s, and that was another whole organizational fight. But all of us were tackling what we thought was so straightforward. So endless meetings, consultations, conferences, task forces, papers, position papers, providing long lists of solutions, very itemized. We were very specific about how things could be improved, but we were pushing against very deep ableism and misogynism.
how did you keep going? What were the highs and the lows? And what were the strategies?
I think one of the things that I did was I was always I was kind of like a moving target myself. I was moving as the issues moved, and I've talked with my colleagues and my friends who did similar work, and one way or another, I was either working for doing a project for an organization, or sitting on a board, or working on a committee. There were so many issues and so many different working groups and efforts that I think partly that kept me going. I think if I had been pushing for one thing and failing, I don't think I could have done 20 years of that. I know I couldn't have. But I was evolving as our issues and groups and things were evolving. I was moving around, so I was with so many different organizations. The Hearing Association, Civic for, the Independent Living Resource Center, COD, but Dawn Canada, Dawn St. John's, I helped start that. The Equity and Reform Coalition, the Canadian Mental Health Association, the Longside Club, Hub, the Newfoundland Labrador Working Group on the Status of Persons with Disabilities, the Coalition, Community Alliance for Better Solutions. So many different things that I think that kept me going, because I was constantly often moving into something new that just might be the one we'd win. And there was just doing the work. I think I enjoyed doing the work. The leadership development that I got myself from organizing meetings and taking minutes and eventually chairing, being connected across the country, across the province, and linked to so many strong people who believed in the same things, nationally and locally, provincially, I think really kept a lot of us going. So there was great strength in that. There was great community in it. And for someone who moved here in 1982, I pretty much arrived into a pretty exciting group of people working together on social issues, and that was rather perfect for me.
And I think from what I know, that disability rights activists in Newfoundland and Labrador were kind of leaders on the national scene.
Absolutely. Whenever a Newfoundlander found himself or herself moving into national work, they inevitably became, if not the organizational chairs, committee chairs, spokespeople. They were doing the media, they were doing the writing. We were a force to be reckoned with, similar to the women's movement. Something about the advocacy in Newfoundland and Labrador generally, people who were involved in the strong advocacy work, really took those skills to the national stage. And that was also exciting. And we might not have noticed it immediately, but it wasn't that long before we were looking at each other and saying, wow, Eric Norman and Mary Reid and Mary Innes and Leslie Macleod and a host of others, once involved at that level. We just wheeled in, walked in, stepped in, and started doing the work because we were good at it. And that's leadership skills. That's the skills you get from going from your kitchen table to eventually coordinating a conference or bringing politicians in so that you could lobby them. Sometimes effectively, sometimes not. Speaking of politicians, one of the things I was remembering getting ready for this is, and we worked with endless politicians. So we were the language police, we were the arbitrators of attitudes. We spent so much time trying to teach everybody to even just use the right language. If you change your language, you will change your perception of the person you're speaking about. We knew that, and it was such a hard fight. But I remember myself and Mary Reid meeting with Premier Wells, and I came out and I was so angry. I was so angry at his intransigence, and I had already been in the meeting on women's issues with him where I was very angry, and he had just said no, he wasn't going to include that LGBTQ people in the Human Rights Code because that wasn't done. So philosophically, we were like poles apart. However, as Mary quite rightly pointed out, he operated on principle. He was a very principled leader. And my response to that was, yes, but I disagree with every one of his principles, so I'm just not happy. So those kinds of things were actually that kind of stuff was energizing because you really got an adrenaline hit and got more determined to try to change things. But we were doing that work at every level that we could find. At the same time, working with individuals. So another joy of the work was people coming in, consumers coming into the movement and finding their voices, finding their places, and developing new organizations. The Consumer Health Awareness Network, Newfoundland Labrador channel, was a group of mental health consumers of mental health services. Language changed. That became their organization, but it was so exciting as they stepped in and started slogging through board development, speaking in front of people, understanding what a constitution might look like for an organization, and then the real work of framing the issues and trying to influence change. And they did and still do, some amazing work of both supporting each other, but also trying to create change. So the leadership development and the empowerment of individuals was probably often what kept the sail afloat while fighting the systems that were endlessly refusing to change. Because why should they?
Can you highlight for us some key moments where you saw some change, like any sort of the qualitative leaps?
One of the ones, and I'm gonna bring it up because of the intersection of women with disabilities and the women's movement and government services. So three of them together. So we had a network of transition houses for women leaving violent situations in the province, but they weren't accessible. And there was physically accessible, nor were they accessible in attitude. They felt that a woman coming in who was, used a wheelchair or had some other sort of disability, they weren't going to be able to understand her needs, and they weren't going to be able to meet her needs. So we've got a system that's not telling them they need to be accessible, not requiring building accessibility or anything. And we've got women who are doing a very good job with the women they're serving, but not willing to step outside of that very easily, putting their hands up and going, we can't do that work, we don't understand that. So there was a group of women for Change that was pulled together, and there were many, many voices that got involved with this. And eventually, transition houses became accessible in this province. So it was a very clear win. And even when they were physically accessible, there were times where we would have to step in and help advocate for individuals who are trying to get in there to say, yes, you can work with this woman. Yes, she has some differences, but she's a woman leaving a violent home. You got to take her in, you can do this work. So there's an example of one. Access to voting. Geez, I had forgotten that very early on in 1991, maybe, somebody had to actually write a paper about the inaccessibility of voting to Newfoundlander and Labradorians with disabilities. That we needed polling stations that allowed them to physically get in. We needed information. People who are blind needed someone to go with them to work with the ballot. Very obvious things today, and thankfully they aren't barriers today, but that was one that had to be pushed by the community to create the change.
And yet, in the last provincial election, I know of two situations where people were unable to vote because of inaccessibility to the polling station. Still.
So it's not across the board the way it was.
2019.
But it shouldn't be happening at all.
Yeah.
And there are guidelines around it and that should have been followed and obviously weren't. So there's our citizenship rights, and there's our right to service, and the whole issue of violence against people with disabilities, huge issue, and one that I did do some work with. Sexual abuse. Sexual abuse was happening in institutions. Always in institutions. It also happened in the new group homes that were set up. And young women were treated very badly. Even when the system discovered that they'd been abused and were pregnant, that was all handled very badly in early days. the Charter of Rights and Freedoms was something that I took particular Canadian pride in, and I also made it a great big banner in my office so that the students I worked with at the college for 6 years knew that the Charter of Rights was front and center, that everything we were doing was based. They were going to be learning and talking within a human rights framework. And so the ability to challenge federally regulated entities, the federal government itself, and provinces based on the charter was a really big area of success, in the sense that it was there, it was written in law that people couldn't be discriminated against because of the various characteristics of disability, age, sex, etc. But the ability to have that document saying, and you can fight this if it happens to you, you can fight back and try to eliminate that discrimination. That was really big. We weren't able to use the Provincial Human Rights Code well here or anywhere in the country. 20 years of Canadian Human Rights Act involvement proved, and there's some wonderful articles written 20 years in, proved that the system was designed to be so wieldly that no one was managing to get any justice. It might be a 2-year investigation and a 3-year maybe sit down and talk about it, an endless thing. On paper, there was protection for rights. The charter really amped up the push to say this is going to have to be more meaningful. And we began to be able to move in both provincially and federally into an area where there was more substance to both the claims of discrimination and the remedies for solving that.
And this might be a good segue too then into the court challenges program, and
near and dear to my heart. If there was anything, the things I would look back on with great affection, excitement, and a degree of pride would have been the Independent Living Resource Center, the precursor to that, Civic Number 4, because it was doing brilliant work, and the Court Challenges Program of Canada. Trudeau's government was brilliant, in saying we're going to not only have a charter, but we're going to put some money in the hands of Canadians who feel we're discriminating against them. Discriminating against them, and they're going to be able to fight us. So there was a very early incarnation of the Court Challenges Program that a successive Conservative government got rid of, and then it was put back in place. And when it came back into place, it was a very strong and vibrant organization. And
so this is a program that allowed individuals or groups of people access to funding, and it was public funding, federal monies, to challenge our federal government in the courts.
And say, you are discriminating against this individual, you're discriminating against a whole group of people.
Where are we now when we look at, you're talking about 30 years of work. Where are we now? As for you as an activist with a long history of working with different groups across the country, within the province, where are we now?
It's better. Looking back, it is better. When I think about the 70s and people were still in institutions and still in their homes, it is better. As you and I spoke earlier, you do see people in my neighborhood. There are people who use wheelchairs who are out with their families, their kids. We do have professionals with all types of disabilities. We have come a long way. I think the ableism still exists. Misogyny still exists. Racism still exists. Sometimes all three of those will come into the same intersection against someone. So we have not become a fully kind, gentle, opening, welcoming country yet. But I would say that we have achieved measures of success. We are not the fully discriminatory, segregated, intransigent country that we were. So there have been improvements. Probably the thing that was the hardest over the 20 years of work, the most painful piece of work, was when Tracy Latimer was murdered by her father in 1993. So a child with a disability, 12-year-old girl, murdered by her father. He covers up the murder, eventually confesses to the murder, and a lawyer pleads the case in the court of public opinion, while the justice system moves on its own track using the legal means. Back in 1993, all the lawyer had to do was announce that a kind, compassionate father had ended his daughter's suffering because she was 12 years old and couldn't walk, talk, feed herself, and was in pain, and that he compassionately took it in his hands to end her life. And Canadians from coast to coast to coast swallowed it hook, line, and sinker.
Mercy killing.
It was a compassionate killing, not even mercy. It was an act of compassion. In fact, a month after he was convicted of second-degree murder, a Calgary Sun poll was done. They polled 500 of their readers, and 97% said he had acted in compassion. That was a win for ableism. And it only happened because ableism was so ingrained in the minds of people across the country. Better dead than disabled was exactly what it tapped into. We lost our minds. I think I spent probably 8 years partly with my head screaming and my heart crying all at the same time. And so angry. It was so obvious what he had done. So there's many facts that support the fact he was convicted twice by 2 juries. There was no question that he planned the murder, carried out the murder, and was unrepentant. And here's what he wanted to do. His position, which he maintained from 1993 and to this day, parents have a right to kill a child with a disability if they decide the child's quality of life no longer warrants its continuation. And his lawyers argued a defense of necessity. He had to kill her because her life was no longer warranting continuation. It wasn't worthy. So at every table I sat at, whether it was friends, family, colleagues in the women's movement, everywhere I went, except within the disability community, I had to argue that with people over and over and over through a trial, another trial, an appeal on the sentence, and then some foolish thing that Robert Latimer was trying to do with the Supreme Court to ingrain the defense of necessity to make it law that parents could kill their children. None of that would have happened if Tracy had not had a disability. Better dead than disabled. The face of sheer discrimination in this country, from grandmothers to just everybody in the community. It was a horrendous fight. The national organizations and local organizations rapidly started finding the facts of Tracy's life and trying to counter that publicly. So every time they said a 12-year-old who couldn't walk, talk, feed herself, and was in endless pain, they would come out and say, but Tracy went to school. Tracy was living in respite care. Tracy had a life. The surgery that was about to happen was going to make that more comfortable. Tracy had a life. She wasn't dying, and she wasn't in endless pain. She was murdered because her life was not seen as being worthy by parents who had grieved her loss when she was born with cerebral palsy, when things went wrong during birth, and they're on record as saying they grieved her when she was born, they lost her then, and then they just ended her life. But it was the media relentlessly spewing out this phrase, refusing to listen to us when we tried to say, call her a child with a disability. Don't frame it in this awful picture that takes away her personhood. She had a right to be alive. So the national groups and the local groups were talking to her social workers, her teachers, the other people who valued this girl, and putting out fact sheets and there was a group called Friends of Tracy that was formed, and we donated money to continue to try to counteract, and it was the biggest mountain of the 20 years. It was oppressive. The weight of people's discrimination against that child was a huge load and incredibly painful. And I did become the one in town that did some of the media. So I did interviews at times while court was going, trying to educate people, just talking about a little girl who had some challenges and a right to a life. And then one of the toughest things I ever did was I went on a live radio program that was CBC, and with a parent, a non-custodial parent of a little girl who also had cerebral palsy and did not live in pain. And I spent an hour on a radio program with her talking about how she wanted to take her child to Europe and have her euthanized, and me talking about exactly why parents should not do that, nor should they feel they should do it. Trying to talk about supports that will help with parenting children with complex disabilities, but just trying to uphold Tracy's right to be a person and her own daughter's right to live her life as it was. The good thing about all the work that had gone on to ensure that the Charter of Rights included protection against discrimination on the basis of disability, and the human rights codes that also did the same, was at the end of the day in 1999, finally, Robert Latimer ran out of time with the courts and reasons to be in front of the courts, and the Supreme Court judge ruled Tracy was an equal citizen. If we had not had charter protection, if we had not had human rights protection, if that wasn't codified, then the court of public opinion may very well have let him off, and he would have been this compassionate hero. And that's not who he was in this circumstance. The facts are out there if anybody wants to research it. There's still tons available on the Council of Canadians with Disabilities website, and articles. There's still research going on about how did the media get that so wrong.
Have we learned?
Have we learned?
Yeah.
I don't think Robert Latimer would be as successful today, but I fear that if it was framed properly, people would still slide that way. Better dead than disabled. We can't have it.
Earlier we had talked, when you were talking about the Tracy Latimer story, there also around the same era was the whole issue of the right to die with dignity versus the right to stay alive in the Sue Rodriguez case. Can you talk a little bit about that?
If Robert Latimer had murdered Tracy, and if that had not become such a touchstone for ableism in this country, I think our involvement with Sue Rodriguez would have been probably more generous to her position. As folks involved in the cross-disability movement, we had great understanding and respect for some of the progressive disabilities and the end-of-life realities. And it's quite unpleasant. And being able to die with dignity and control made eminent sense for us. But at the time that her case was being adjudicated through the courts, we were also seeing the court of public opinion saying that parents had the right to kill their children. So it was a very worrisome time for us, and it was very nuanced in our own hearts and minds, because although we wanted to see that option available, we were so legitimately terrified that if laws had been constructed at the time, that they would have gone to the extent of permitting parents to euthanize their children based on their say-so, that child's life wasn't worthy of continuation. So we were very torn between being supportive of an individual and all of those in the same position, and needing to be very loud and clear on the absolute need for the courts, for our laws to protect the right to stay alive for people. So it was a very challenging and again painful time. of lots of discussion and examination and soul searching, and then looking at the law, looking at criminal code law and regulations and the systems around us, and saying, how will they handle that? Would they possibly allow the protection? Or are we going to end up with a euthanasia, forget that word, are we going to end up with a dying with dignity bill that is going to allow medical people to determine whether someone's life was worth continuing, because they had been deciding that forever? Would that get codified? Most doctors do everything to do no harm and to prolong life, but within the disability history, there was an ending of life too, by medical lack of treatment and other measures. So where was that really going to go? If we put that in the hands of the courts and the politicians of the day, one of the judges that was part of that led the second jury trial for Latimer stated that he was sympathetic to the man, but the jurors convicted him. The judge had actually been sympathetic. So it was a very dangerous time to be moving on that kind of legislation. The mood of the country would have propelled it potentially in the wrong direction. So we found ourselves speaking against something in order to protect the lives of people, when we could have been working more closely with and simply helping shape what we now have in this country, which is some death with dignity and control, which the new law does still need to be nuanced and changed as we go, but it will forever need protection for individuals so that they're not literally murdered in the name of dying with dignity, because that will happen.
Which just goes to show how important it is to constantly, whenever we're looking at policy, at law, at legislation, how important it is to stop and say who's not at the table.
Exactly.
Who is not at the table, and to stop the conversation until that table is representing
exactly
of our country.
Which was the work that we were doing in the 80s and the 90s to bring voices to the table, to bring them into the broad discussions of how our society should be structured. So the coalition, or the Community Alliance for Better Solution, I always called it the coalition, that brought diverse members of the advocacy community together to present realities to the public, so that if the politicians were talking about doing something, we could say, oh, they're talking about that, but what's really going on is this, and to also present those solutions that were brought together by many people at the table to say, this social policy will be helpful. What you're thinking about won't. So lots of work being done on that. And there was a time where, and we were talking about it earlier, my colleagues and I, about a time when one of the governments actually respected the work that we were doing, the knowledge that we had, and in fact sent Newfoundland and Labradorian advocates to represent the province of Newfoundland and Labrador at national tables, where there was no Office of Disability here, literally paved the way and said, all right, Marie White, Mary Reid, Leslie Macleod, you go to those meetings and you represent this province. So there were times where leaders were very respected and included in social policy. Julie Bettany is the one politician that will forever stand out in our minds. She consulted all the time, and you were at tables. We were brought together under that cone of silence to review potential policies that might be coming up, and to give real input, real meaningful input.
What are you most proud of in terms of some of the work that you have done in some of the advocacy groups in Newfoundland and Labrador have done together? As a province, and as you as an activist who has worked in community, is there a highlight? Is there something that you are most proud of?
I think the strength and the level of sophistication that we had when we were working really keenly together across issues, and that we made sure as we became an advocacy community. So it was Canadian Mental Health Association, it was numerous organizations really working together to propel social policy was probably the highlight. We were smart, we were in tune with each other, we worked well together, we created real recommendations, and we tried very hard to make positive change. That was really quite something. The strength of organizations and strong, clear leadership, and being able to clear away the clutter of all the individual issues for every organization. Because there were sometimes turf wars over, whose rights are being trampled on the most, who needs to be in front, where's the hierarchy of disability, who's on first, who's being left behind. There was all of that too. There was a lot of organizational work to be done, and personalities, and sometimes male-dominated tables that needed to shake up. But when we were able to do it all well, there was a period of time where we were a force to be reckoned with, and that was such a highlight. And the strength of the personal strength people got with working with such like-minded people, the relationships, the friendships, the shoring each other up in the fights was amazing.
It's nice. When we spoke yesterday, you talked about the movement from taking care of to empowerment. Can you talk a little bit about that? Because when you're talking about independent living and all that, just that cultural shift within the disability rights movement, just
right. So something that people with disabilities knew really well in the 70s was that they were sick to death of having people take care of them and make decisions for them. So that was the growth in the 70s was the propelling of the voices of the individual people with disabilities and coming together to be strong about that. When I said earlier that people were kept out of society, that they were in the back bedrooms and institutions and not in the classrooms, really, the medicalization of people with disabilities had been going on for a long time, where people were kids who were born with disabilities, people who acquired disabilities, were seen as someone to be taken care of, to be protected, to receive their basic needs, but to be taken care of. And that's not what people needed. All of us need to grow up and live our lives as lives of our own choosing. So we all need to have control over the decisions from what we're going to wear in the morning to where we're going to go to where we're going to live, who we're going to talk to, who we're going to like, what we're going to hate. We all need to be ourselves. We need to be equal citizens, as the Supreme Court judge said. And it was a huge mind shift because our social systems had been designed to take care of us. Even those two specialists thought they were taking care of me and future generations by telling me I needed to be sterilized. Well, you got to do the big flip that over and say, what do people need in order to live lives of their own choosing? And they need information, they need support, they may need different kinds of assistance, but assistance that they direct, that they choose, that they own at the end of the day. So if you need a wheelchair, it better be the one that you're comfortable with in the color you want. Simple fact, not a hospital chair that somebody has given you. The right to get married, the right to be a sexual human being, the right to go to work, go to school, all of those things. So the big shift and the education shift, the attempt with systems in the 80s was to really push to say, you got to stop taking back care of people. We all need to collectively enable each other to live our own lives and not the lives that you choose for people. And so that was every social worker, every doctor, everybody holding the purse strings for supports for someone. We were re-educating them all the time to put control in the hands of the individual. And for people like myself who were doing it based on a very clear excitement over the charter and an anti-discrimination framework, it was very simple. But one-on-one, when you're dealing with the people actually doing the work, you had to be a little more nuanced and personal and try to find, we used to have to dig in and find the thing in their life where they lost control. So we did workshops designed to dig into the lives of professionals for them to find when they lost control, how it felt, and therefore to truly understand how important it was for the people they were supporting to also have control. It was quite amazing and endless. But I think we made the shift. I think most people out there today would not think that people need to be taken care of just because of a disability that they